Weight loss is about shedding pounds or kilos, traditionally through diet or exercise, and now there's an entire industry around it, which in the U.S. alone is worth $75 billion last year and growing according to market data firms. Now there's something new that promises faster and easier results. Drugs like Ozempic and Wegovy and Mounjaro, popularized by celebrities and social media influencers, these drugs promise you as much as 20% weight loss with a weekly injection. But at least two of these are actually being used off-label. Ozempic and Mounjaro both were developed to help control blood sugar levels in adults with type 2 diabetes. And for more on the pros and cons of drugs like this, I spoke with Eric Feigl-Ding. He's an epidemiologist and chair of the public health at the New England Complex Systems Institute, and he talks about the access to these new pharmaceutical drugs.
First of all, it is doctors who are prescribing it. These drugs are from prescription. You cannot get it not via prescription. But the issue is that doctors are prescribing it off of the label, as in they're giving it because patients want it for weight loss, even though it's technically authorized for diabetes, for Ozempic, they're giving it. So they are getting it from doctors and demanding it. Doctors are writing the scripts for them, and ergo causing the shortage. People have to take them anywhere from 6 months to a year, some studies longer than a year, but the weight loss is significant. But I caution that a large number of people, or we're talking about 80–90% of people, then start regaining the weight that they lost the moment they go off the drug. And again, these are not cheap drugs. So will they have to keep on them? Will it be a drug cycle? And again, these are very expensive drugs, sometimes $1,000, $2,000, $3,000 a month if you don't have insurance. So this is one of those long-term questions where, is this sustainable? And is it just for the rich and wealthy and well-heeled? Lots of questions. And again,
Doctor, if I heard you right, you said $1,000 to $3,000 per month, correct?
Yeah, if you don't have insurance, insurance right now will only cover it for diabetes or severe obesity for Wegovy. But for the most part, if you don't have severe obesity and it's not getting Wegovy, Ozempic is not approved for weight loss, and most insurance will not cover it. Almost all insurance at the moment will not cover it. People are strategizing, should they cover it, but that's a longer debate. Right now, they're not being covered.
Right. The state of the industry, I threw out the $75 billion number of people who spent that amount to try to conduct weight loss. The numbers that I was reading is in the next few years, we're expecting that number to shift to $150 to $300 billion with a B. And with those numbers at 1,000, 2,000, even take the low end at 1,000 a month of what you're saying, I know it's not covered by insurance. That seems to be an awfully high number that you're asking these patients who have severe needs or really truly need to reduce weight for the benefit of their health. It just seems like a very high number.
Yeah, right now it's becoming this luxury item that only the rich can afford. And even if you do have diabetes and need it, and it's covered by insurance, you can't even get to it. So it's one of those privileged drugs. Will we expand access? Will we expand coverage so relatively middle class and lower income individuals can access these drugs? And of course, they oftentimes have greater risk of diabetes and heart disease. So this is opening a huge can of worms of, is this cost sustainable? Especially if we know that 80–90% of people lose weight the moment they stop these drugs. How can we make this sustainable? Because the cost of this on our healthcare system is going to be enormous. But at the same time, benefits of weight loss and diabetes prevention is also really good. But this cost, how do we swallow the pill? Again,
very quickly, doctor, for those watching this, if they're interested in these drugs, what should they ask their doctor, and who is a primary candidate for this?
Yeah, they should ask their doctor, like, am I at risk of diabetes, and am I at a severe obesity level that my life is is being imminently threatened. And I think those are good questions to ask. It should not be a fad drug. It should not be an excuse to not exercise. It should not be an excuse to not eat healthy. Again, you should do all of those things. But I think right now, the highest risk people who have diabetes, definitely ask your doctor. If you have extreme morbid obesity, ask your doctor. But beyond that, if you're a borderline, you should not use this as a go-to easy weight loss kind of magic pill. But again, long term, I think that's where we're headed with the huge explosive growth of these drugs. And the newer versions won't even require a once weekly injection. They'll simply be pills that you pop. So we're getting to that point where we need to decide, what do we want to prioritize in society?
Yep. Yep, some good advice there. Thank you.